Bon Secours Richmond Health is the only faith-based not-for-profit health system in the Commonwealth of Virginia. Our ministry and our faith-based orientation provides the backbone of our mission, which gives us the ability to provide for those that are underprivileged, those that have the need for access in healthcare. Within the healthcare landscape, there are often areas of opportunity that we can't fully address. Philanthropy plays a huge role in being able to address those gaps. Without the support of our families, without the support of our foundation, the idea that we provide the total experience for our families and our patients would probably not occur in the same way that we want it to occur. That support is invaluable for us to meet and treat the mind, body, and soul as we strive to do within Bon Secours Richmond Health.
So our journey with Bon Secours began on September 20th, 2009. On that day, my son Finn was born at another local hospital, and he was born in distress. He needed to be resuscitated, and we learned that he had not gotten enough oxygen about 30 minutes before delivery. He had to be rushed to St. Mary's Hospital because the hospital where he was born didn't have the right equipment to care for him. So once he was admitted to the NICU at St. Mary's Hospital, if it wasn't for the neonatologist, we would have lost him. All of his organs were failing due to the lack of oxygen, and we didn't know if he was going to make it. But thanks to the neonatology team, day by day, he got better slowly, and we were discharged about 35 days after we entered the NICU.
Finn was our firstborn, so probably like every expectant parent, you think you know what is coming, and you think you're ready, and obviously as a parent, this was not the journey that we expected or anticipated. It was particularly obviously challenging in the beginning, and it seemed that every year unfolded new challenges, just as you thought maybe had kind of figured out where we were going or what we needed, or there would be a new challenge.
The area of his brain that controls movement was severely injured. And so 12 weeks after we were discharged from the NICU, he was readmitted to the PICU for feeding tube surgery. Since then, I would estimate that he has probably been hospitalized at least 40 times. So when Finn was 3, he was diagnosed with cerebral palsy, which is just an umbrella term for a neuromuscular disorder that originates in the brain. So at this point, Finn can't sit independently, he can't walk, he can't move his mouth well enough to speak, and he can't use his hands.
There you go.
Yeah, Finn.
Yeah. Smile for mommy. Yeah. You're gonna love that.
So the high point in Finn's life has really been probably the last 7 or 8 years. He has gotten so much bigger and stronger and more resilient. He is such a happy child. One of the other high points has been watching him take steps in his walker at Richmond Hope Therapy. When we watch him do that, he is just so proud of himself, and it's just amazing to see that. If it wasn't for the care that Finn receives from Bon Secours, I don't know what his quality of life would look like or how much more complicated our lives would be. Working with all of the specialized doctors, nurses, and therapists at Bon Secours has meant so much to us because they all have access to his medical records. They all have access to his medications. And when we need to go to the PICU or the ER, they have a plan of care that's specialized just for him, which takes so much of the anxiety away from us in an already really difficult time.
When you have a complex medical problem, it isn't just one specialty. The whole body is connected, so you can't just treat one area. the collaboration you get with Bon Secours, with all the teams coming together, has just really made the biggest difference probably in Finn's life.
To families who have donated to Bon Secours Pediatrics, that you have no idea how much these gifts mean when a child is sick or a child is struggling. Big things from a state-of-the-art therapy center to little things like a vein finder that can help a child who's in the ER have placing an IV less scary and less painful. Donations, big and small, bring so much comfort and assistance to families who are struggling. For Finn's future, my hope is that he is happy and that he enjoys his life. And he has the best chance of doing that if he stays healthy. So for that reason, Bon Secours will always be an integral part of his life so that he can fulfill that dream that we have for him. This is the happiest, bravest boy that you'll ever meet.